Can surgical reconstruction for bone cancer last a lifetime? When it comes to surgical reconstruction after bone cancer treatment, the idea of it lasting forever is more complicated than it might seem. While these procedures can restore limb function and improve quality of life, they usually do not last a lifetime without needing some form of revision or additional surgery. One common method is endoprosthetic replacement, where an artificial implant replaces the removed bone segment. Some studies show these implants can last over 25 years in certain patients. However, only a small percentage, around 18% in some cases, keep their original prosthesis after nearly 3 decades. Most patients will need additional surgeries over time, often due to complications like infections, mechanical failure, or loosening of the implant. On average, patients might undergo about 2 to 3 revision surgeries during their lifetime. Biological reconstructions, which involve using bone grafts from the patient or a donor, aim to create a more natural and potentially longer-lasting solution. These can sometimes last many years, but they are also prone to failure. For example, studies report that 5 and 10-year survival rates for biological reconstructions vary widely, from about 20% to 80%, depending on the type of graft and individual factors. Failures such as non-union or graft failure often mean additional surgeries are needed. It is important to understand that the risk of complications does not disappear over time. Infections can occur years after the initial surgery, and mechanical issues like wear and loosening tend to develop gradually. For instance, some data shows implant failure rates around 29% at around 15 to 16 years after surgery. Despite these challenges, surgical reconstruction often provides excellent limb function and high limb salvage rates, sometimes around 90%. This means many patients can avoid amputation and enjoy a better quality of life. In summary, surgical reconstructions for bone cancer are durable but not permanent. They can last many years, even decades, but most will requiring additional procedures at some point. Patients should expect ongoing monitoring and personalized care to address potential complications. This approach aligns with current medical understanding, which emphasizes that while reconstruction offers long-term benefits, it is not a lifelong and changing solution. Always consult with healthcare professionals to understand the best options for individual cases and long-term management.